Nearly 10,000 Ukrainians have entered the U.S. CBS News special report on Vicki Barker.
Welcome back to Talk of the Town on 99.7, 1450 WHTC and WHTC.com.
We welcome you back to Talk of the Town for this Monday, April 11th. I'm Gary Stevens. We are very pleased on this second Monday of the month to have as our regular feature this time the thoughts and impressions of State House Representative, third-term Republican Mary Whiteford of Casco Township, joining us via the Zoom connection this morning. Mary, glad you were able to get back, although you got back into town when I got up at 2:30 this morning. I'm glad you're with us.
Yeah, thanks, Gary. Good morning, everybody.
Tell us a little bit about what led you into being in D.C. Over the weekend.
Yeah, there was a conference put together on mental health. And legislators from all over the country were invited. And I was one of the few that was actually on a panel discussing behavioral health financing, which has been, most people really don't even think about that, but it's a line item in our budget that has gone from about $3 billion to $4.6 billion just this current year. And I'm really working hard to make sure that every dollar goes to where it's intended. And it's pretty murky and pretty complicated, but I had a chance to explain how Michigan currently does our system, but also the proposal that I have that could save between $100 and $400 million a year. And that money would go directly back to providing services for the people in our community. So it's a pretty big deal. And I was really fortunate to be invited to go, but those flights are being delayed everywhere. And I thought I was getting away with not having a delay.
Yeah, unfortunately, that's not the case at all. If you got a question for the state representative, she'll be happy to take it at 616-395-1450, 616-395-1450. And of course, we'll have more open line for any topic that you might want to discuss following the top of the hour news. As you are in appropriations, and certainly part of what you do is make sure that certain areas are funded and funded well. How have we seen the improvement in funding in mental health, especially? That's right up your alley. Since, well, maybe I'll be honest with you, since the time you took over, a little bit of watching the appropriations on that.
Yeah, from the very beginning. Mental health is not an easy fix. You know, you can fix roads, you can fix infrastructure, but how are you able to have that early intervention for those who need it most? How do you make sure that they get the services that they need? What's gone on in this process? And fortunately, honestly, I'm really blessed. But from the very beginning, I've always focused on this crisis and access line, and it is in West Michigan now. I will get you that number. I don't have it off the top of my head, but it's expanding throughout the state and will be completely intact by the end of the year. And it'll be 988, so the National Suicide Hotline. But what that means is anybody can call. I can call for help for myself and find a local provider. You can call for your child. A police officer can find out where to take a person. Even an emergency room nurse can find out where there's a psychiatric bed that could be used for their patient. So it's very comprehensive. And it's really one of the top in the nation. And I think it is the top. I explained that to the legislators when I was there. So we've got that going on. What's really hard is we don't have everything ready right now. And I keep pushing, but we have to have these infrastructure investments. And I'm feeling very confident that we're going to be able to do that to make sure we have a new psychiatric hospital over on the east side of the state, but also really, really focus on West Michigan. And I've got a plan for some really good West Michigan investments in my budget. And I hope to have that out to everybody in the next couple of weeks. But doing these investments, making sure we have psychiatrists and psychiatric nurse practitioners and social workers with experience. So some of the proposals that I had in the current year and in this next budget that I'm working on now is a way to have more psychiatric nurse practitioners and these social workers with specialty training. I've got University of Michigan, Michigan State University, and Wayne State University have come to me with proposals that has really, honestly, it's made psychiatric nurse practitioners a cool profession right now. We set up a program for 40 psychiatric nurse practitioners, and they filled up in a matter of a month. And they're asking for more funding to get more of these nurses in their doctorate program. So things are moving. It's like that barge I always try to talk about, keep it moving forward. But we are at a crisis. Our kids are dying. Our families are suffering. and it breaks my heart. And I'm doing whatever I can to make sure that people in the Department of Health and Human Services understand this is dire. We have to do something. We have to keep having these access points and the professionals to do it. We have to have mental health parity. Our insurance companies, they've got high deductibles for private insurance, or they limit the number of visits a person can get to see a psychiatrist or psychologist. This can't happen. So we're working on some parity bills too, to make sure everybody has that opportunity.
By the way, Mary, the number for the mental health, it's a text or a phone, is 1-844 and then 44, spell out the letters MICAL. 1-844-44 MICAL. I think I got it right there, Mary, didn't I?
Yep, you did get it right. I had to write it down just to make sure we have it straight. Yeah.
All right.
844-446-4225. I'm officially on the website. It's saying that it's serving the Upper Peninsula in Oakland County, but my understanding that it's been worked into West Michigan already.
I do want to touch upon this before we talk about a few other things that are going on in Lansing. Since last we chatted, Mary, the governor has signed legislation that you've been behind. The opioid opt-out plan is now law in Michigan. Tell us all about that.
Yeah, so this, just going back to fundamentals, I've had patients, I've had family members, I've had friends who, if they've had surgery, they walk out with a vial of medication. They don't know what it is. They just start taking it every 4 hours. Well, it's an opiate. And they don't realize that you have to do more than just take an opiate to have your pain control. Yes, it's for really bad pain, but you shouldn't be taking it on and on and on. So what this bill package does, it makes sure everybody knows what their choices are ahead of time. It makes sure that a doctor or your medical provider has that really important conversation with you about how you're going to control your pain. So if you want to have an opiate, or if the doctor recommends it, like right after surgery, I've had a few, I know how important it is for pain control. But you get to a point that you can take other medications like anti-inflammatories. Or when I got a tooth pulled, my dentist didn't give me a vial of narcotics. He gave me prednisone for 5 days. And that was amazing. It worked for me. But it's so important to have those conversations ahead of time. Everybody needs to have that knowledge for their bodies and work with their doctors to do their best. So what this bill package does, it makes sure that everybody has a pain plan. So it's a non-opioid directive that you talk through with your doctor, that you talk through with your health insurance company, and make sure that everybody's got those tools in their back pocket and decrease the chance of individuals getting addicted to opiates without understanding what happened. I have a friend, she had a knee replacement. She ended up addicted to drugs too, because she didn't know better. And then things just kept spiraling out of control. So let's nip it in the bud in the beginning to the best of our ability. It goes back to that early intervention, early access. So I'm just so glad that the governor recognized how important having everybody involved in their pain plan, and that she signed it into law.
Yeah, indeed. And the thing is, too, and I just saw this story this morning on our wires about, it's not Michigan, it's a Florida story, but a trial to prove that Walgreens is at least partially responsible for fueling the opioid epidemic in the state of Florida begins today. And Florida just recently reached a massive $879 million settlement with CVS and other companies for their part in the opioid epidemic. Hopefully, we don't have to get into that type of situation in this state, but still, it's there, Mary.
Yeah, well, you bring up a really good point, because we are getting a very large sum from that opiate settlement. We're getting $800 million over 20 years. It's about $20 million to our state and another per year, and this spread out. And then $20 million are going down to local communities who have applied to get some of this fund. And I've got a hearing tomorrow. I'm the sponsor of 2 out of 3 of the bills that sets up this fund and makes sure that the intent is followed through. We have something called a tobacco fund that's supposed to be working to help people stay healthy and not smoke. It's been rated for so many different uses, namely over in Detroit, believe it or not, for the public schools and the bailout with the city of Detroit, but other things that I don't think is proper. So this will specifically lay down the rules. And it was a highly negotiated bill package between the governor's office, the attorney general's office, the House, and the Senate to make sure that that intent is followed through. So we are talking about tomorrow in judiciary. and I'll present my bill package then.
Mary, you were reading my mind about the fact that you mentioned the tobacco settlement and how that money got spent or misspent. And you just don't want that happening with the opioid money.
Absolutely not, because we have an opportunity. Now, one of the things that I heard yesterday when I was at my conference is to be able to take the normal treatment for a substance use disorder is 30 days, but expand it to 90 days. Because you need that extra time to help that brain to heal and help that person change their habits. And that would be a really good use of these funds. For me, it's making sure we have that early intervention. A lot of times before somebody gets addicted, it's because they're self-medicating mild mental illness, anxiety, depression, whether it's alcohol or any other kind of drug, to try to help that person feel better. Number one, because they can't get a psychiatrist or a psychologist appointment. I mean, they could be 8 months to get an appointment. And I just heard from somebody else for their child. So that early intervention piece is one of my key priorities.
Foster care. That is a topic that a lot of people are still very important about. Not just foster care for the small and defenseless, but also foster care for those who aren't so small and aren't so defenseless. And you got some legislation that you're going to be dealing with.
Yeah. So I chaired the Adoption and Foster Care Task Force last year. It was a 6-month bipartisan task force that we met with Supreme Court justices, other judges, courts, attorney guardian ad litems, who are these kiddos' attorney, families, even children who have aged out of the system, and came up with a bunch of recommendations. About half of them I worked into our current year budget. Even having some funds for foster care closets. So these are some money for people who are about to foster a child, and making sure that we have proper rates so that the kids get support from foster workers, because there's such a turnover. But half of the package, or half of our recommendations, we worked into a bill package. So we have 10 bills right now. I'm probably going to add a few more because I had to open up a few more sections of the law. But I think the biggest one is that in Michigan, we define kin as blood relatives. There's some other states who have changed that definition to a non-blood relative. So say, like when I grew up, I had Aunt Julie down the street, who was very, very close and a trusted adult in my life. Is it better for a child to go to a stranger's family or to a non-blood relative? And I think it's better for a non-blood relative. In these, the states that have done this, they've gotten down. So none of the children are having any, they call it maltreatment in care. Where they're hurt. So it's much better for the kid to go with somebody who they trust, of course. So my one bill, which I think is the big meat of this package, it redefines who kin are and to be able to allow that. And that's the bill that we have to open up a few other areas of the law to make sure that we get that definition right. But we'll be having a hearing in 2 weeks, from what I understand. And it's bipartisan. It's a great group of people, but even setting up a foster care commission. So we have consistency. Even when the executive changes and the legislature changes, there should be a commission to make sure that we're moving forward and not backwards in how we support the children of our state who are most vulnerable.
And kids who are vulnerable also need some support in terms of specialty care, because the state's shutting down some facilities. And are we coming back to like 30 years ago when John Engler was closing down some facilities and we had a big crisis with mental health at that time? Is this almost as bad as that? Or maybe I'm just overblowing this.
No, it really is. It's really just like that. So I'm glad you brought that up. What I've been hearing from the department when I first started sharing this budget, so 4 years ago, is that it's best for children to stay in their homes and not go into facilities for specialty care. You know, these are the worst of the worst kids, the most struggling, hurting themselves, hurting other people, or even in the juvenile justice system. So of course kids need to be home, but that's not reality. There's kids who have been traumatized, who have mental illness, who are just so challenging that they need the specialty support. Well, the department has been shutting these down. They'll have a situation happen and say, oh, this happened, you guys are closed. So we have these empty facilities, but now we have right now like 150 children who are waiting for some of the specialty residential care, and they have nowhere to go. So either we're shipping them out of state, or they are staying in their families and causing harm to the rest of their siblings, or they're in hospitals in just regular beds or in emergency rooms. So we're in a really crisis state. And I've been telling the department, come on, we've got to stay on top of this. We've been begging them for the past year. So the culmination of that is we're going to have a joint committee hearing tomorrow morning, 8:00. So I'm going to be out really, really early tomorrow, getting up when you get up, Gary, right? Mm-hmm. And then we're going to have some of these organizations come forward and say, hey, we've got a plan for the children of our state. And this is what's going on. So I hope that we have some positive responses from the department in relation to this, and just bringing it to everybody's attention that there's these kids out there who really need our support. And that is one of the biggest responsibilities of as us as a state and me as an appropriator, is to make sure that this is done right.
If you have any issues that you might need the assistance of the staff of State House Representative Mary Whiteford, especially if you are in Allegan County, you can contact the office through this number, area code 517-373-0836. Again, 517-373-0836. You might call her office, and maybe you are not living in the current configuration of the district, but Mary's staff would be more than happy to direct you to the proper, not only state rep or senator or perhaps state office, to be able to help you with your individual problem. Again, the number for Mary Whiteford's office in Lansing is 517-373-0836. I'd like to do that whenever we have our elected officials, so that they can contact your office. And part of what is at the office is good pens, good phones, and maybe a machete or two to cut through the red tape.
Yep. We're very good at cutting through red tape, so give us a try.
All right.
Thank you, Gary.
As always, Mary, thank you very much, and we hope to talk with you next month.
Yep, and have a blessed Easter, everybody.
Thank you very much, Mary Whiteford, on 99.7 and 1450 WHTC.